Welcome back to our BCBA exam prep series. I'm Katherine Kellogg, and this is week 13, part 2, discussing our FBA information, specifically functional analyses today, as well as preference assessment. Going to dig deeper into advanced applications, modifications, and how to assess behavior. Is specifically how to set up experiments and guide intervention designs. These practical applications are really what the BCBA exam tests, not just what they are, but how we apply them and use them, as well as the benefits and weighing out all of the risks. Let's get into it. So first, we know how important it is to assess motivation. Specifically, we want to have an idea of what the function of the behavior is. Now, this is a key part to our intervention when we're identifying replacement behaviors and trying to figure out why the person is doing what they're doing. We have four main functions of behavior, and this does give us information again on how to create the best interventions and insight. So, with a functional analysis, this is an experiment within the FBA process that isn't always required, but does give us a sure, clear picture of what the function is. It's the only method that tells us and confirms what the function is, whereas the rest of the methods are hypotheses. By now, we know the functions of behavior. I'm going to share a visual that helps discuss each of these and how we would implement an experiment based on these functions. As you can see, the four functions of behavior, we'll start talking about escape first. And so this is when someone's trying to escape something. So after we've already assessed what are they trying to escape? Are the antecedents clear? Do we have reinforcement? Is it a motivating environment? If we're trying to just figure out and test, are they doing this for escape? In an experimental setting, considering all risks and benefits, you would want to present demands and instructions and then remove the demand for 30 seconds when the behavior occurs. 30 seconds is an example that can be adjusted, but the escape piece and removing the demand does show that if the behavior continues, then yes, this is an escape function. But I think above all else, so although this might give us an indication of what the escape function is or confirm that, we really don't use escape extinction anymore at all. And we want to really ask ourselves, why are they trying to escape and how can we make this environment more pleasant so that they're happy, relaxed, and engaged? Some key words that might be on the exam: task avoidance, demand escape, social avoidance, or activity termination. And these are all reasons and valid reasons why someone might want to escape. The escape part alone isn't the problem that we're trying to fix. It's just how they are indicating that they want to escape. So instead of potential dangerous behaviors, we want to replace that and still say, yes, you can escape, but let's do it in this way instead, using a picture card or vocalizations if possible. For attention, this one will be minimal attention will be given, and then attention will be given after the target behavior happens. And this will give us that idea and confirmation if the behavior is attention seeking. Does the person use this behavior to gain social interaction, get noticed, or get people to engage with them? If that is the case, then we are kind of coming to the conclusion that that person needs more positive attention or appropriate attention in other ways. Some key test words might be social interaction, being noticed, negative attention, engagement seeking. So all of this is behavior and important behavior for us to acknowledge. Automatic reinforcement, sometimes sensory seeking, sensory stimulation, internal pleasure, self-soothing, neurological factors. This one's very important to understand and identify. So if the behavior is happening alone, and the person's alone in a safe environment, and the behavior is happening like hand flapping or nose picking, and there's no social consequences, there's no social interactions that would reinforce the behavior, no demands or preferred items removed, that does indicate that automatic reinforcement is present, or if it's happening across all conditions. Access to tangible would be another one that we might test for. And this is where you give brief access to a preferred item and then you remove that after the target behavior happens. And if the target behavior persists, we know that they are trying to seek access to that preferred item. We're really trying to test, does this person use the behavior to gain access to preferred items, activities, or experiences that they want? For the BCBA exam, key points when you're looking at FAs, really interpreting results you want to look for clear differentiation between conditions. I'll show you a graph in a moment and we'll talk about that. The condition with the highest rate indicates the likely function. There's a control condition or a play condition where it's just the individual playing with no specific contrived settings. Multiple functions, sometimes the behaviors serve different functions. You might see two that rise to the top, and you want to consider a combination of functions when necessary. Safety first. FA procedures can increase behavior. We don't want to do them on dangerous behaviors. We want to make sure that we are using brief FAs, which we'll talk about in a moment, or latency measures, and a safe environment to make sure that we are adhering to ethics and doing the best, most utmost safe procedures for our clients. Here is an example of a functional analysis results graph. You have the sessions on the bottom, and then you can see here that attention is red, escape is orange, alone is purple, and then there's a play condition here. So this one does not test for access, but it does test for the other three. And the play and alone, you can see that the behavior of head hitting does not happen frequently. But you can see with the attention, it happens a lot. This could be connected here. And you can see that the 8 occurrences indicate to us that we do see head hitting occurring for attention-seeking behavior. Okay, so this gives us a pretty clear indication that yes, it's attention-seeking. What should we do? We should try to provide attention and a lot of attention in other settings that are appropriate so that Sarah, in this case, doesn't feel the need to head hit for attention. Based on this functional graph, what is the likely function of Sarah's head hitting behavior? And we determined together that is social positive reinforcement or attention. So the answer is B. In our data analysis, when we are looking at the attention condition, it shows that it's consistently the higher rates, 7 to 8.5. There's a moderate rate under the escape condition and then low rates and near zero in the other two. So here's the answer for you with the brief explanation. So as you're looking back, you can review that. Okay, I wanted to briefly talk about special considerations when we're looking at real world functional analysis. Often they require modification from the standard protocol, and the BCBA exam loves to test these clinical decision-making skills based on individual needs and safety requirements. A BCBA has to be present to implement a functional analysis. There are different types, so we'll talk about those here. There's a brief functional analysis, which I would say is probably the most common. It's rare that we implement these regularly. Oftentimes with just an FBA, we get enough information. Typically, they're about 5 minutes instead of 10 to 15 minutes or longer. You can use these when the behaviors are more severe or resources are limited and you don't want to evoke the behavior, or if you need quicker results. The trade-off is sometimes the data is less stable, so you need a clear differentiation between conditions to draw conclusions. The trial-based FA, this one I do also like to implement because it embeds the FA conditions within the natural routine. So I feel that this one says NET and natural within. It's, for example, during math class, you might alternate between providing help immediately when the escape behavior happens or versus providing attention after a problem behavior. So you can do it in a natural way, but sometimes it is harder to control variables, but you can take data on that and try to come up with your own functional analysis conclusion in the trial-based format. Latency-based FA is next, and this measures time to behavior occurrence rather than the frequency. It does sometimes work for severe behaviors that you can't allow to continue. So once the behavior starts, you implement the consequence and end the session immediately. It does maintain the experimental piece of the FA without limitations or issues with safety. So that sums up our FA portion. When I talk about ethics in the future, we will talk about more ethical considerations, but we always have to weigh the risks and benefit analysis before we choose to implement an FA. Next up, preference assessments and intervention. Preference assessments are important to identify potential reinforcers, and we want to integrate these results with the FBA process so that we have an idea of what will motivate our client. Preference assessment considerations for younger children or early intervention, shorter trials, fewer intervention items, or focus on approach behaviors rather than explicit choices. Maybe we just have a naturalistic free operant assessment where they just float around in the environment and we note down the duration of the time that they play with the item. This can work well. Sometimes we have more specific preference assessments, like we have multiple stimulus with replacement. We have different items and we will replace them and compare with one another. Or we have multiple stimulus without replacement, where we just present them, remove it, present the next, and don't bring it back. There are benefits to both. I think that with replacement does give you that full assessment and comparison between all of the objects. And without is quicker, so you can get and gain a quick understanding of what's motivating. But they do need to happen frequently because preferences change all the time. So although we can have an idea of preferences, we're going to have different motivating situations like satiation and deprivation that will influence the results and influence motivation. The types of preference assessment include, like I mentioned before, free operant. This is the continuous access method where you present multiple items simultaneously, and the person, often younger or someone who may not be able to scan in a visual field, has access to all the items, and you score how many items they go to and what they're most preferred based on how much and the duration of the interaction. It's natural and shows realistic preferences, and it's quick to implement. Sometimes there can be a satiation effect and competing stimuli. It can be hard to control the variables, but I do think that it is best for individuals um, who are younger or maybe have a hard time making choices or relinquishing control of an item. Pair choice is two items at a time, and the person can choose one item. This is also great for the younger kids, and you can do this in a ranking system. It's a clear preference hierarchy and it reduces choice overload. So, someone who would do better with two choices versus a long array. It can be time consuming with many items. Forced choice may not reflect natural preferences, and order effects might also implement, or rather, be a limitation. Order effects might also impact results. Multiple stimulus without replacement, you can present an array of items like 6 to 8, and the person picks one. Then it's removed from the array, and the process repeats until all items are selected. And you can select the hierarchy. There's a clear hierarchy, and it does reduce satiation in that way. Sometimes there might be a position bias. We want to make sure we're mixing and varying that. And also, it can be less natural as well. MSW, multiple stimulus with replacement. This is the same thing as above, although you are putting the items back. And so you have a clear, stable preference understanding, and it can identify the strong preferences, and then you're able to compare all of them. So, and this is a bigger array sometimes, and it's more of a lengthy process. Single stimulus, also somebody who might have a limited choice skill ability. It is simple to implement though, and you can just give one item at a time and measure the approach to behavior, engagement time, or acceptance or rejection. Each item is presented multiple times across sections. Each item is presented multiple times across sessions. Here is a quick comparison guide of the assessment, so you can pause and save this if you'd like. And then also for BCBA exam key points, make sure you choose the assessment type based on the individual's abilities, time constraints, and level of need. Remember too, the preference assessment isn't saying that it's going to be a reinforcer. We're not testing if it's reinforcing the behavior, but we are gauging motivation, and we're able to then set up the environment so that it's motivating. Also consider reassessing regularly, cultural considerations, and environmental factors as well. It's best to combine preference assessment results with an FA findings in order to design the most powerful intervention. Use preferred items as reinforcer for functionally equivalent replacement behavior. So match the function. That wraps up our deep dive into functional analysis and preference assessments. So remember, these assessments are only valuable when they guide effective intervention design. And functional analysis are only required when we really don't know the function and we have the tools, the resources, and have weighed out all of the risks and benefits associated. We want to continue to do preference assessments so that we know what motivates our client in the moment. And next week, we'll move into reinforcement procedures. So, we're going to start exploring how to systematically strengthen appropriate behaviors and implement extinction along with reinforcement. Drop your questions below. Make sure to like and subscribe to get notified for each weekly video. Thanks for watching. See you next time.